More than 2 million people identify as transgender in the U.S., according to the Human Rights Campaign. Yet while transgender people have gained more representation in pop culture and daily life in recent years, they still face severe discrimination, stigma, and inequality. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, during Transgender Awareness Week, we're talking about the importance of equity in healthcare for transgender individuals. With me today is Dr. Chris Humphreys at St. Luke's Primary Care Mission Farms and the only certified member of the World Professional Association for Transgender Health, or WPATH. Thank you so much for joining us.
Thank you.
So first of all, Dr. Humphreys, can you explain what WPATH is and its role in equitable healthcare for the transgender community?
Yeah, so the World Professional Association for Transgender Health is a professional organization. It's multidisciplinary, it's international. It's a group of providers and researchers who are dedicated to promoting excellence in transgender health.
Now, WPATH released updated guidelines for the first time in 10 years this September. What are some of the major takeaways or updates from these new guidelines?
I think the biggest change really is the tone of the Standards of Care 8. It is centering the experiences of transgender and gender diverse people in a way that hasn't been evident in the 2012 or previous editions. That is more respect for the lived experiences of trans folks, and that's just an exciting change, and I think that we're going to see more of that from WPATH going forward. There were also new chapters. There's a chapter dedicated to education, which is a huge part of WPATH, educating providers, the public, healthcare providers particularly. A chapter on sexual health through the lifetime, which is exciting. Adolescents got their own chapter for the first time before they were together with children. And most exciting for me is a whole chapter on non-binary identities. I identify as non-binary, and it is very affirming to have a whole chapter that validates that.
Well, that's great. Okay, so what services and support does St. Luke's Health System offer to the transgender and gender diverse community?
So we're really lucky at St. Luke's. We have a robust group of endocrinologists and specialists that have decades of experience with transgender health and gender diverse people. We have plastic surgeons, we have mental health, social work, primary care. Also, St. Luke's has been designated as a healthcare quality leader in LGBT plus care by the Health Equality Index, which is a benchmark, national benchmark that designates our facilities as providing the top care for LGBT plus individuals and also for their employees. So it's not just patient care, but it's people that work for our health system are getting that level of excellence.
Oh, fantastic. So what else can providers do to be a good ally and to help lessen the stigma around the transgender community?
Most providers are very open and well-intentioned and just want to provide excellent care. None of us really had training in this in medical school or residency. This is all new. I think that the most important thing I would ask my fellow providers in any specialty to do is to ask SOGI questions. So sexual orientation, gender identity. Asking those questions of all patients, even established patients, will create an affirming environment in which you are going to learn a lot about your patients and you are going to make them feel welcome. I started doing this when I joined St. Luke's in 2017, and I was nervous about some of my established patients, how they would receive it. And more often than not, I would get responses from people like, "Thank you for asking this. This means a lot to me. I can tell St. Luke's really cares about its patients," or they would tell me about a niece or a nephew or a brother or themselves. And I think that as providers, it can be scary to put that out and not be prepared for the answers. But I think it needs to happen, and your patients deserve and expect it.
And what about the general public? What can each of us do?
I think educating yourself, not relying on your LGBT, your trans family, friends, acquaintances to get all the information about what's going on. The Trevor Project, PFLAG, Human Rights Campaign, all of those have excellent resources for the public to educate themselves. And if you hear people being hateful and awful, speak up. An unfriendly joke or comment on someone's appearance, stand up and say that's not okay. I think that's what it's going to take to change hearts and minds.
Absolutely. Well, is there anything else you'd like to add?
Yes. So this is National Transgender Awareness Week, and there is a very important survey that's only active for a month, and it closes on November 21st. It's the National Transgender Survey. It's put out by the National Center for Transgender Equality. This is only the second time they did it. The first time was in 2015, and they got 28,000 responses. And the data from that study is informing policy, is informing research that's being done. There is a vital amount of information of the lived experiences of transgender and gender diverse people that can be gleaned from this survey. It's a long one. It takes about an hour to complete, just warn you. But it is very detailed and will get a lot of information. I use the information from the 2015 survey every day. It's the study that showed that transgender people had a 40% higher rate of suicidality than the general public, where it's estimated to be about 0.9%. And that is information that has really gotten better care and helped decrease the healthcare disparities. And so I just encourage everyone to fill out that survey if you're transgender or gender diverse, or get it in the hands of somebody that could fill it out.
Okay, a very important survey to help us learn more.
Exactly.
Thank you. Well, thank you so much, Dr. Humphries, for joining us.
Thank you, Lindsay.
To learn more about transgender healthcare services offered at St. Luke's, visit stlukeskc.org/transgenderhealth. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.